Hello everyone, let's talk about the cervical sympathetic chain. It basically has three ganglia, as you're already probably aware. And the first one is the superior cervical ganglia, which happens to be the largest one, the largest ganglia, and it's like fusiform in shape, and it's like 2.5 centimeters long. So that's pretty much that's a lot. Now, as far as the formation of this first ganglia is concerned, it is formed by the fusion of four ganglia corresponding to C1, C2, C3, and C4 vertebral levels. After that, we have the middle cervical ganglia formed by the fusion of the ganglia corresponding to C5 and C6. And then we have the inferior corresponding to the C7 and C8 ganglia. Right, and the important one is the first one, the superior cervical ganglia, although the rest are rather important too. Alrighty, so we all know that the sympathetic chain basically contains the cell bodies of the postganglionic sympathetic neurons, but you need to know from which segments of the spinal cord do the preganglionic fibers enter into the chain. And in the case of the cervical sympathetic ganglia, no white rami communicants from the cervical area enter. The white rami communicants which contribute to the formation of the ganglia or which enter the ganglia are from the T1 to the T4 level. So that's an important distinction, an important high yield point to understand. That the white rami communicants which contain the preganglionic sympathetic fibers, they basically enter into the chain from the T1 to T4 levels. Now this is not hard if you keep in mind the fact that the lateral horn which contains the preganglionic sympathetic neurons are only located in the thoracic part and the initial couple of lumbar spinal segments. There aren't any lateral horns in the cervical part of the spinal cord. Alrighty, so this was the biggest one, and then we had the middle and the inferior. Now there is this loop which connects the middle to the inferior cervical ganglia, and we'll talk about that in a bit more detail later. So that's an interesting thing to keep in mind. Might come up in an MCQ. Right, now all three of these ganglia, they basically send these fibers or these nerves to the heart, and they're referred to as the cervical cardiac branches, right? And there are two plexuses in the heart. There's a deep and then there's a superficial, right? Alrighty, now the left and the right superior cervical ganglia, they have different contributions, meaning they both give the cardiac branches, but they contribute to different plexuses. Normally we consider, now for most of the cardiac branches from the superior, the middle and the inferior, we consider that they contribute to the formation of a plexus known as the deep cardiac plexus, but with one exception. The left superior cervical sympathetic ganglia gives off a cardiac branch which does not contribute to the formation of the deep plexus, rather it contributes to the formation of the superficial plexus. The left superior sympathetic cervical ganglia gives off a cardiac branch which, instead of contributing to the formation of the deep plexus, rather it contributes to the formation of the superficial plexus. Alrighty. Now, so we're done with the cardiac branches, which are rather important. And one thing to understand is that all of these ganglia are going to give off branches which will form sympathetic plexuses around various arteries. For example, we consider that the superior sympathetic ganglia gives off a branch known as the internal carotid nerve, and this internal carotid nerve, as the name would have already suggested to you, forms a plexus around the internal carotid artery, and from there, if you have any rudimentary understanding of the parasympathetic ganglia, the fibers, they basically pass through various sympathetic ganglia without relay and basically reach their destination afterwards. Right, so this was the superior. This one is the middle. And this one over here is the inferior. Now all of these, while they do not receive any white rami communicants from the cervical area or we can say none of the cervical spinal nerves contribute white rami communicants to the cervical sympathetic chain, but all three ganglia they do contribute gray rami communicants to the cervical spinal nerves, right? So the first one contributes a total of 4 gray rami communicants, which obviously contain preganglionic sympathetic fibers to the upper 4 cervical spinal nerves, and the middle basically contributes 2 of them to the 5th and the 6th cervical spinal nerve, and the inferior one will contribute the 7th and the 8th. So that's a very neat way to kind of like understand that. Now, in addition to the cardiac branches and also other visceral branches which need to be kind of understood. So previously we were talking about the internal carotid nerve. Now the middle basically gives certain branches which form plexuses around the subclavian artery, right? And so that is important because that makes us understand that there is also a sympathetic plexus around the subclavian artery. Now the inferior is a bit of a overachiever in that it sends, or it is responsible for the creation of plexuses around 2 arteries. My apologies, this one was for the inferior thyroid, I was mistaken. And this one creates plexuses around 2 arteries. There are 2 major arteries, in fact. The subclavian, as I said, the subclavian artery and the vertebral artery. And you must know that the vertebral artery is, in fact, the first branch of the subclavian artery, so that should make it easier to remember. And in fact, the inferior thyroid artery is also a branch of the subclavian, technically a branch of one of the trunks of the subclavian. This is important. Now, other than the cardiac branches, all of these do contribute other visceral branches. For example, the first one contributes especially towards the pharynx. The second one especially towards the thyroid. And if you've already done the thyroid anatomy, you would have seen that particular wording that the sympathetic innervation is derived from the superior but mostly from the middle. So I'm hoping that makes sense now. So over here we have the thyroid. Above we had the pharynx. And that's it for the basics of the cervical sympathetic ganglia. I'm hoping this made sense.